Brain injury, whether sustained at a test firing range or in battle, has long been a priority for the defense medical system. The Warfighter Brain Health Initiative this year has boosted its research efforts on service members' cognitive abilities and how certain events can threaten those. For an update, we turn to the Director of Warfighter Brain Health Policy, Kathy Lee. Ms. Lee, good to have you with us.
Thank you. It's good to be here.
Brain injury, traumatic brain injury, has long been a focus, obviously, of defense health programs. But you now have this Warfighter Brain Health Initiative, something new. Tell us what you're trying to accomplish here.
Sure. So the department's top priority is to take care of our people, which includes promoting brain health and countering traumatic brain injury. And as you just mentioned, we've been a world leader in the area of traumatic brain injury, or TBI, care and research. And as we've been since the beginning of the Afghan and Iraqi conflicts, and during that time, we really noticed that we needed to expand our efforts beyond just injury, but to expand those efforts to look at brain threats. And that's really how the Warfighter Brain Health Initiative, or WBHI, was born. This is a real thing. It's a joint effort between operational and medical forces, and its focus is really to optimize brain health. And we are looking at brain health through the lens of optimizing cognitive and physical performance. So we're really looking at thinking skills. That's very important for warriors, war fighters, service members. And so we have a big focus on that and how it gets impacted by threats in the environment, such as blast overpressure, training with munitions and such. And then all the things that we're doing related to traumatic brain injury is now under this umbrella of Warfighter Brain Health, so that we can maximize coordination efforts across the department.
And relative to some of the earlier issues that you continuously deal with, that is injuries in battle from concussions or shots or whatever the case might be, this sounds like it kind of brings together a bunch of concerns, including what can happen in training, in firing not even live rounds, but nevertheless there's a blank which is right next to the soldier or the airman's head, whatever, the naval person's head. What are some of the other factors of brain threat that you need to look at?
Firing munitions and training. The training environment is one that we really have an acute focus on right now and awareness to, so that we can understand better the health and performance brain effects from firing various weapons, either, as you mentioned, live fire or in training scenarios. So what we're really trying to get after is three things. We want to be able to monitor that brain threat. We want to be able to document the brain threat, and we want to instill safety and mitigation efforts to try to avoid unnecessary blast exposures as the threat we're talking about right now. But there's other threats we're looking at too, such as, repetitive head impacts and other things that can really have some type of impact onto your brain health based on what you're doing in an operational environment.
Is there a way to monitor and measure what is going on without having an actual brain subjected to it? That is to say, if a particular, say, shoulder-fired weapon produces a certain concussive and sound proportion that's measurable, can you see what it does to a bowl of Jell-O, for example, instead of what's happening with someone real?
So we've just completed a pretty large initiative over the last 4 to 5 years, the congressionally mandated initiative, actually, where we did multiple studies looking at what the health and performance effects are. There have been numerous, what you're describing is preclinical, not using human beings, but rather preclinical studies that have looked at what the effects can be on the brain tissue, in the blood, and looking at different areas within the blood. And then in our human studies, looking at the symptoms and how it's affecting the person from, in this case, again, blast overpressure. But it is noteworthy that the Warfighter Brain Health Initiative is not just looking at blast as a brain threat, but other things within our operating environment in the U.S. military that could have effects on brain health. And so we're very astute and attuned to those.
What are some of those?
So repetitive head impacts. That's another area. If you are getting your head hit many times from jumping out of airplanes and various other maneuvers. We're also looking at other threats such as directed energy threats and things that could affect the central nervous system based on that. And we're also looking for emerging threats, things in a future fight, future warfare that may end up impacting brain health in training environments or through enemy action.
And a few years ago, I was reading about brain health in respect to NFL players, and sometimes there is damage that can only be discerned through an autopsy when the person is deceased and they section the brain and so forth. Have there been advances in the ability to measure the brain of a living person such that you can maybe get a finer grained sense of what's going on with someone than we could in the days when you had to section a deceased person's brain?
Sir, great point. Looking at the long-term and late effects from both repetitive exposures and numerous injuries is one of our lines of effort. It's actually line of effort 4 in our plan. So we have a lot of activities, and we are accelerating for exactly that purpose that you just said, is not to wait until somebody's deceased and you're looking at postmortem tissue, but rather trying to see how we can signal this early on and therefore intervene and be able to provide some treatments. So that's a very active line of research. I can't tell you today that we have that for somebody, we're still looking at those brain tissues and understanding, but we are looking at some other novel ways to be able to pick that up in living folks.
We're speaking with Kathy Lee, Director of Warfighter Brain Health Policy in the Office of the Assistant Secretary of Defense for Health Affairs. And what are some of the ways that you measure people through these series of tests and say what's going on in the environment? You mentioned there's a performance issue, a cognition issue, and then that might be distinct to some degree from whatever might be the pathological issue. And what are some of the measures of the cognition and performance that don't involve looking at tissue?
Great question. So as I have pointed out, cognition or thinking skills is the main indice right now that we're looking at for brain health. So are you brain healthy? We're looking at your cognition, and we're really trying to get that on par. As people know, physical performance is very highly into our culture in the military, and we are working to get the cognitive thinking parts to be on par with that physical performance. So that being said, the cornerstone of this program of Warfighter Brain Health for the department is a cognitive monitoring program. So we are beginning this summer to perform a cognitive test. We've been performing cognitive tests since 2008 on all those that we're going to pre-deploy. And now we're expanding that requirement to perform cognitive testing on everybody in the military every 5 years. So that will be our benchmark to baseline cognition, and that provides us the opportunity to either enhance it and improve it, or even to restore it if it's been decremented by some of these brain threats that we've been talking about.
Do you ever look at, since given the population that tends to populate the military at the training and infantry and naval warfare and frontline levels, young people, mostly young men, but young women now increasingly, and the effect of having their ears plugged with music all the time to a greater extent than anyone in human history as maybe adding a little bit of marginal effect on what they're getting in training?
So interesting that you asked that question, because the initial military training sites is exactly where we're starting with the cognitive monitoring program. So I can't answer your question about the music and that per se, but we are going to be starting that program, as I mentioned, next summer, or this summer, 2024, with the initial military training sites, so that we can ascertain baseline cognitive measures as you enter into the military. And then again, we'll get the rest of the force so that we can ensure we have a baseline on everybody. That includes the Guard and the reserve components as well. And every 5 years, that'll be checked for that intervention time, so that you can either enhance it or restore it.
And do you exchange information or testing methodologies or data with, say, organizations like the NFL or the NHL or, I don't know, Worldwide Wrestling Entertainment?
So we have a very productive and long-standing relationship with the NCAA. That has probably been our one of our prime partners in this inquiry and endeavor to look at brain health and exposures. As I mentioned earlier, we look at sports-related concussion and repetitive head impacts. So that is another threat as well. So we have partnered very nicely and effectively with the NCAA. We do have some work that we've done with the NFL through this over 20 years of really leading the world in traumatic brain injury related research and care.
And is there a feedback mechanism for what you're learning to, say, the people that develop training doctrine